search, when they come up, you'll see it says
The first one.
Choose a template. Yeah.
See, it reset.
There you go.
All right. Welcome, everybody. Happy Tuesday. I'm so excited. You know what? Y'all might recognize this handsome fella. This is Dr. Miles Bodzin, and he hails from the beautiful San Diego, California, although he is broadcasting live from the South in Tennessee. So we are so excited to have him. As you know, he is one of my all-time favorite speakers. I've had the great pleasure of traveling all around the country with him over the last couple of years. And I mean this with all of my heart. I have probably learned more about presenting and the power of communication when it comes to talking to your patients about patient financials from him more so than anybody else that I've heard, which is why we frequently ask him to come back. He's also the sidekick to another frequent guest, Miss Holly Jensen. Yep, she's over there in the corner. Hi. I'm so excited because I'm getting on a plane and going to fly out to see Holly. We're both going to Montana where we're going to freeze our butts off, but that's a story for another day. Ladies and gentlemen, I introduce Dr. Miles Bodzin, and he's here to talk to you about the No Surprises Act.
Well, thank you, Krista. I think you're getting better and better and better every time you do this introduction. So thank you so much for having me, and thank you for the ChiroHealthUSA for inviting me back. And I'm thrilled to share with you guys a topic that is a somewhat new topic. And as a result of it being new, there seems to be some confusion out in the chiropractic profession in regards to it. And my hope is to simplify it for you, because quite frankly, once you see this is done, not only is it simplifying it's simple to understand, which is great, but it'll actually, quite frankly, I'll show you how it actually helps you grow your practice. And it's not often that something new comes up that helps you grow the practice as well, if you're not already doing the things that this requires you to do. We know that there are requirements we have to do in practice, and this whole thing came out and kind of caught a lot of people off guard. They didn't even know about it. And so the goal today is to present it to you, simplify it for you, and show you exactly what you need to be doing. So let's go into my slides. I'll share my screen here. Let's see. I will do that right now. Back here. Thank you, Holly. Right there. Share, turn screen, share on, screen one. There we go. Sharing the screen. Whoa, that's psychedelic right there. Let's change right here. And slideshow. All right, that's me with my funny looking face on the screens there. And let's get started. Okay, so today's material, let me just start off by saying the materials I'm going to be sharing with you today, anytime I'm going to be showing something on the screen that deals with fees or talks about fee schedules or anything like that, as a disclaimer for educational purposes, I got to state that any fees represented are for educational purposes only. They're not a suggestion of what you should be charging. Likewise, we're not making any suggestions here that you should be leaving or boycotting an insurance company. Everything here is for educational purposes. Apply it as you as you shall see, or as you shall see fit. All right, so let's get right into it today. Today was all about the No Surprises Act and simplifying it. And I'll refer to it as the NSA. That sounds very, scary, NSA, but it's No Surprises Act. And let's just kind of review a few things here. Number one is the No Surprises Act is meant to prevent patients from getting a large bill as a surprise when they assumed the provider was in network and turned out to be out of network. So this is kind of came about where someone goes to the medical doctor or the hospital, for example, and maybe the hospital they go to is in their network, but somehow a doctor that's out of network in the hospital sees that patient, and then the patient gets a bill in the mail that surprises them that they weren't aware of. Or another scenario is maybe the person gets in an accident and they have to be life flighted, and the life flight is not part of their insurance, as an example, and they get hit with this big bill. That's really kind of the intention behind this act to begin with, was to protect people from these surprise bills. And we all know that healthcare bills are oftentimes one of the leading causes of people going into bankruptcy. And this is really basically put in place to protect people from that type of thing. So the question might be is, does this even apply to chiropractors? Well, the No Surprises Act, to accomplish this goal of the No Surprises Act, the NSA states that patients must be aware of two things primarily: the cost of your services and the patient portion due. So those are two different things, right? One is the total cost of a service, and the other part of it is what is the patient responsibility of those services. Those are the two things they need to be made aware of when it comes to your fees, for example. The NSA is basically a consumer protection act. We've heard of consumer protection acts in lots of different areas, and this is just another example of that, where people are being protected against, I guess, bad practices or what they would consider a bad practice that potentially could harm someone. Does the NSA affect chiropractors? This is the big question. The simple answer is yes. The simple answer is yes. Whether the patient has insurance or not, or self-pay or not, does not matter. The NSA affects all chiropractic practices, basically with all patients. Cash, let's kind of go through some different categories, because you might be going, well, I'm a cash only practice, or I do insurance, or I do, Medicare, whatever it may be. Does it affect me? Well, here's kind of how it goes. And by the way, this materials that I'm sharing with you, a lot of this is referenced from either emails that were sent out by state associations, or articles that have been read, or going right to the direct source. So we're kind of just summarizing it all. There's been a lot of good material coming out in our profession in regards to this, this topic. Cash only providers, patients with no insurance, or patients with insurance that you are not in network with. So this is according to the Code of Regulations that it's stated right there, that basically if you're cash only, we often hear this a lot from doctors who are cash only, where they say, well, the rules don't apply to me because I'm cash only. I don't have to deal with the insurance rules or whatever it may be. And the answer is that is never the case. You are not excluded from following rules just because you're a cash only provider. And when we say cash only, let's just define what that means, just since the topic came up here. Cash only means you're dealing with no insurance at all. You're not doing PI, you're not doing Medicare, you're not doing, a lien with a PI case, for example. You're not just collecting the money and giving people super bills. Like, you're literally cash only. There's no super billing, any of that kind of stuff. Next is Medicare providers. So for your Medicare patients, or as a Medicare provider, any non-covered service, anything that's not covered, you would need to do this with this, because in essence, that's the portion that the patient's paying out of their pocket there. For Medicaid patients, if you're seeing any Medicaid patients, non-covered services when you're in network, or all services if you're out of network. So if you're a Medicaid provider, not a lot of you are, but if you happen to be, this is an example that you need to be aware of. What does this mean? Basically, patients need to be made aware of your fees and their portion, and here's the kicker, prior to receiving the services. It must be in advance of, not after the fact. So that means no matter what you're doing, whether it's a new patient calling on the phone to make an appointment, whether that's a new patient that's enrolling in a care plan, whether that's a returning patient from the past and you haven't seen them in a while, these people need to be made aware of the fees prior to you rendering the services and their portion of responsibility. So when a new or returning patient calls in for an appointment, here's some suggestions. Now, I'm not here to tell you what the script should be. This is not the intention of these next couple slides. It's just kind of tell you what your responsibilities are. There's some great scripting out there. I know ChiroHealthUSA also has some great scripting when it comes to discussing fees over the phone and making suggestions on how you might benefit from using ChiroHealthUSA versus not using them as an example with a new patient. Talk to Christy in regards to those kind of scripts that I know they have available. But what you see on the screen here is, let me just kind of direct your attention also to the right side of your screen, where it shows that graphic with the CA answering the phone and taking the call from the patient. But underneath it, you see it says step 1 of the loyal patient journey. Just kind of make note of that term, loyal patient journey, because we're going to come back to that. Because my intention today is to help you not just understand this No Surprises Act, but to also show you how utilizing it will actually help you grow your practice. And when's the last time you had that happen, where regulation, like I said, helps you grow? So what insurance do they have? So you're going to find that out over the phone. Are you in network with that insurance? And that's going to impact what's being discussed. You're going to need to tell them over the phone an estimate of what the exam and any tests you're going to be doing. So if you do, exam and x-rays, there's no more of this kind of song and dance, like, oh, we'll just let you know when you come in, and, kind of skirting the issue. You got to be transparent with these people. And that's kind of be the word of the day, transparency. You want to be transparent with people, and there's no kind of like hiding behind things. So that's the key there. Tell them over the phone an estimate of what the exam and diagnostic tests will cost. This is an example, saying $400, maybe it's $100, $150, whatever it happens to be in your practice, but they need to be told that up front as an example. Next is when that new or returning patient arrives for that appointment. So they arrive in the office. Included with your new patient intake forms, or your patient, returning patient intake forms, should be a written estimate that matches what was told to the patient over the phone. The estimate should list the exam and any diagnostic testing again, and have the patient sign that form. So in essence, there's nothing magic about that form. It's just simply something that says, hey, you're coming in for an exam and x-rays, and that's what they're coming in for, and here's the cost of that. And they know what those services are. They know what the cost is in advance prior to doing this. I'll just share a little tip with you. I've been, teaching, the whole cash model for many, many years now with our company Cash Practice. And one of the things we've always taught our doctors forever, 20 years now or so, is after you finish a consultation with a patient, prior to examining them, we would say something like this. Let's say you are my patient, and let's just say Sam is my patient. I say, hey, Sam, now that I know what's going on with you, and I know it's time to go to an exam, that's what I'd recommend we do next. prior to doing that, as a courtesy, we like to let everybody know the fees before we proceed. I hope that's okay. The cost of today for the exam is going to run you, XYZ, $90 or $100, and the x-rays are going to be at most $120. Is it okay if we proceed? There's an example where prior to me going on to the examination, I would actually get the patient's verbal communication, verbal confirmation that it was okay to proceed prior to doing so. And this was long before any of this kind of No Surprises Act, simply because we wanted to make sure they agreed to it. And that's more from a business perspective, quite frankly, than a regulation standpoint. It just made good business sense to have agreement over fees prior to rendering those services. I'll also just share with you, if you caught what I said, I didn't say to Sam, hey, Sam, let me tell you the fees. I said, hey, Sam, as a courtesy, we tell everybody the fees. Make note of that. This is a little subtle thing we do in our communication, because if I say to Sam, let me tell you the fees, there's always the possibility Sam might interpret that as they don't think I can afford it and might take offense to that. So when I say to Sam, hey, as a courtesy, we tell everybody the fees, let me let you know what it is, it neutralizes the potential of that negative consequence. When Christy was just now introducing me and she made the kind comments about how she's learned from me about communication. Thank you for saying that, Christy. It's very kind of you to acknowledge that. That's an example of what I'm referring to. What I just shared with you is an example of a communication that has a drastic impact on what you say, on the effect you have on a patient. If you say it right versus wrong, as an example. So just a little tidbit there for you. But from the going back to the No Surprises Act, in essence, what we're saying here is you're going to have some signed document on that initial visit that basically is letting them know in advance there's going to be the fees. Now, whether you do it right before the consult or if in your office you don't charge for a consultation, that's what I did in my office. There was no charge for the consult. So I did it prior to the examination, which is when the fees actually would take place. So as long as you're doing it prior to you rendering services that require the patient to pay, that's, I think, the most important thing in this scenario. The good news is, in all likelihood, your existing financial policies you already have your patients doing right now probably already does this. So there's probably nothing new you have to do here. Maybe some of the communication over the phone might be new for you, but in essence, paperwork wise, you're likely already satisfying this requirement and there's no real need to change anything. If you're not doing this and you don't have it, then yeah, you'll need to add it to your practice. But in essence, you're likely already doing this. So that's the good news. Now, prior to starting care of a new or returning patient. So here's the scenario: is the patient was new and you went ahead and, you did a report of findings basically. And, it's time to enroll them in whatever you're recommending for care. Or it's a returning patient that you made some new recommendations for, and it's time to enroll them in care. Whether that's 1 visit, 10 visits, or 50 visits, whatever the care is, they're ready to go with that. At that point in time as well, you need to do the same thing. You need to give the patient a comprehensive, and I say comprehensive, that's my recommendation, that it covers everything that you're recommending, financial plan listing out all of the services and products with fees and for what period of time. So the notion of saying, I'm just going to recommend a program and say it's X dollars for come in, and you're not being detailed about what you're offering in there. You're not specific about what services it is. Because the reason I'm bringing this up is because we've seen this out in the profession where a practice will, or a doctor will not list out everything they're doing. They'll just say, my care plan is X dollars, for example. You can't do that. You got to be very specific on how many adjustments, how many therapies, is there orthotics? Is there, nutraceuticals? Like, what are you doing in your care plan? List it all out. It's going to come to some total amount of money for that patient. And that is revealed to them prior to them enrolling. Now, again, if you've already been doing care plans and all that, you've been doing this all along. So this isn't new for you. And if you haven't been doing any kind of care planning or going over fees with people in advance, well, then this will be new for you, that you need to do this prior to them saying yes to care. You see the image there where it shows the big number 5 on the bottom right. What I'm going to share with you in a brief moment is what we call a loyal patient journey. It's an actual process of seeing someone through the entire journey of that person, everything from phone call all the way them from getting care to transitioning to wellness care. And there's actually 11 steps. And I'm just kind of highlighting this is step 5, where generally we are sitting down with the patient and going over their care plan, their treatment plan, and having them enroll in care. So that's what we're doing here is prior to them actually starting care, you've sat down with them, or your CA sat down with them, and you've gone through all of the finances and their responsibilities. Again, I'm going to guess most of you watching this right now are probably already doing this. And if you aren't, then you're going to need to start doing it, not because, it's because it's a good practice thing to do, which I'll show you here in a moment, but because the No Surprises Act is basically saying you need to do this now. I find it fascinating, quite frankly, that this is something that I have been an advocate of now for a good 20 years now, of putting people on care plans and going over fees and stuff in advance of, simply because it's good business. It's good to, you'll see in a moment here what I'm talking about. But now we have a regulation that's saying you got to do it. And it's kind of saying to the doctors who haven't been doing it, it's time to step up and do it. I find it fascinating that typically regulations aren't things that people are looking forward to doing. This is one of those ones that just happens to align with good business practices. Presenting your patients a comprehensive financial plan, i.e. what I call a care plan, will help you grow your practice. That's what I want to kind of transition to here in just a moment here. It'll help you grow your practice. And whoever thought of a new regulation would actually help you grow your practice. Again, I'm kind of finding that as a fascinating thing myself personally. It's not often we see that. And I'll show you what I mean by that here in just a moment. When we do a care plan, it's actually a legal document. It's actual agreement that defines not just what the services are, but what are the terms of the agreement, how long is care, what happens if their insurance changes, what happens if they get in a car accident, now they're a PI patient. How do you handle all of this stuff? What if they need to stop early? How do you prorate their account? All of those types of things. Now, the days of just doing a homemade spreadsheet, calculated care plan and coming up with your own terms, those days are long behind us. It's not necessarily going to give you something that keeps you compliant. There's much more to a care plan than you just kind of writing some numbers down on a sheet of paper and coming up with something. You have to have specific terms in there. So let's kind of go through this just kind of briefly here. One thing I want to point out is that the No Surprises Act actually refers to this as a good faith estimate. That's the terminology they use, a good faith estimate. And quite frankly, I think they stole that language from the mortgage industry. If any of you have ever, bought a home or got to refinance your house, you'll always notice they give you, within 3 days of you, I guess, agreeing to work with them, they send you some paperwork called a good faith estimate, which is kind of laying out the terms of your financing you're going to be doing. And that's probably where they got the language. So we have that terminology on our care plan where we say good faith estimate. And there's other requirements that are required in your care plan. For example, you need to have your EIN on there. You got to have diagnostic codes. You got to have on there birth dates of your patients. There's a number of things they require. None of it's crazy difficult stuff, but nonetheless, you got to have you're going to want that on your care plan, for example. Now, care plans. Now, I want to just kind of introduce you to a new term that you probably have never heard before. You'll see there where it says forecasting care. Care plans is basically when you put together the financial side of when you forecasted the care of a patient. Forecasting means predicting the future. So you as the physician, as you as the doctor, as the chiropractor, you're now saying, I believe my patient's going to require 4 months of care, 6 months of care, 8 months, whatever you believe it is. And that's a whole conversation in itself on how you determine what that is for yourself. But nonetheless, you as the physician have made that clinical judgment that you believe the patient's going to take 6 months of care. I'm going to see him 3 days a week for a while, then twice a week. I'm going to do progress exams, a new set of x-rays, orthotics, a cervical pillow, nutraceuticals, whatever it is your comprehensive program is for that particular patient is custom tailored to that person. You build it out and we call that forecasting care. The care plan is the actual document that outlines your forecasted care. So care plans not only act as your good faith estimate, which is what, from the No Surprise Act, but they improve patient compliance to your treatment plan. That part I bolded there. Quite frankly, the reason we've been teaching care plans for the last 20 years and software and all the things that we provide as a company for this is that last part there. We have seen time in and time out that when you apply a care plan to a patient, when you utilize them, you will have better treatment plan compliance. You will have people following through with care. Quite frankly, it'll increase your patient retention. When we see simple terms, forecasting care increases patient retention. Now, when we hear of patient retention, many of us make the mistake of thinking, oh, that's all about PVA and getting better numbers, and it's all about the money side of things. And that couldn't be further from the truth. PVA is a reflection of how successful you are on getting great results. Let me prove my point. Would you agree that if I had an adjustment that I could reach through the camera right now and teach you right now, and that adjustment would always give you better results? Like I taught you the adjustment and you applied it to your patients and you always got better clinical results. Would you want to learn it? And now I know you're all saying yes right now. And the reason I know is because when I ask this question in front of a live audience, I get every hand raising up. Yes, I want to know that adjustment. So my next question to you is, if you agree with that statement is, would you agree one of the reasons you don't get the best results with a specific patient is not because you don't know that adjustment. It's simply because that particular patient dropped out. They didn't follow through. They didn't follow your recommendations. And I bet every one of you right now are agreeing with me because, again, when I do this in a live audience, I get agreements that patients dropping out of care is one of the reasons you don't get the best clinical results with a person. You know you could do better with them, but they just aren't showing up or they just disappear. So if you're willing to learn an adjustment to get better clinical results, then I suggest, and this is something we've been teaching for 20 years now, that you learn what it takes to get better retention, better follow through, so you are able to get better clinical results. It'll ultimately allow you to deliver on the promise of chiropractic care. So I'm transitioning to the subject matter right now because ultimately the No Surprises Act is giving you the rule saying you need to go over fees in advance. And I'm now transitioning to say, not only is it a requirement now, it serves you. It literally helps you improve in your practice. And I want to prove my point, because when you have poor retention, what is it costing you, doctor? What is it costing you in your practice? It's costing you the fact that you're making less money. I'll be forthright with it. You're getting less money in your practice. You're also getting poorer results as a result of people not following through. It's costing you a number of things, but more importantly, what is it costing your patients? What it's costing your patients is, quite frankly, poor results. They're not getting the full benefits of your care, which means they may not refer, lots of things. I think the bottom line is that I think we could all agree that when patients drop out, it's not good for you. It's not good for the patient. Now, successful high profit chiropractic practices have one thing in common. They all have it. And I am fortunate right now to have the perspective of literally working with thousands of chiropractic offices, close to 10,000, quite frankly. And we've seen with all of the data, we can get a broad stroke view of what's going on in these successful practices. They all have high retention. Every one of the practices that we see that has extraordinarily high success, they have this in common. They have a very high retention of their patient base. In fact, we call that, when they have that, they have what's called loyal patients. When they have a high retention practice, their practice is full of loyal patients. And when I referred back to those graphics earlier, I was showing you that step 1 and that step 5, where I was showing that little cartoon on there. That's a step in this process of creating a loyal patient. And I find it so fascinating that here we have a regulation that came out, and this regulation kind of plays right into this whole process of creating better results with patients as a result of helping them follow through. Now, I want to just share with you, when it comes to creating a loyal patient, there are a number of things you have to do. But the results of that is that 80% more likely to choose you over competitors when you have a loyal patient. They're twice as likely to recommend you to others, and they're likely to spend twice as much. So there's a lot of benefits for you in the practice to have your patients becoming loyal to you. I'll give you the definition, in my opinion, as an example of a loyal patient. Years ago, I was interviewing patients of mine, asking them questions like, why are you still here? You've been coming in for years. I'm just really curious, because I was digging in deep to figure out why patients stayed and why patients didn't stay. And an example of this was a teacher that I interviewed. And when I interviewed the teacher, I asked her this question of, you've been here a couple hundred visits, you've been here for years, why are you still coming in? And she went on to say in her interview that, I got insurance that would cover me if I went somewhere else, but I'd rather stay here and pay for myself because of, and then she listed off all these reasons why. But the point is that she literally had care would be paid for going somewhere else, and she chose not to do that, pay out of pocket and stay where she was at because she was so loyal. That to me defines a loyal person. There's nothing that's going to sway him away, even insurance being covered somewhere else, as an example. What makes a patient loyal and not drop out? So if I've kind of whet your appetite on, well, I want to have a loyal patients, the next question you should be asking is, well, how do I do that? We kind of led into this care planning part, but I'll be frank with you, there's more to it than just putting someone on a care plan. I'm just going to mention the other parts of this. We don't have time today to go into all the details of that. We're going to stay focused on the care plan portion of it. But I just want to introduce you to, there's actually 4 key things that are required for creating a loyal patient. Number 1 is loyal patients need feedback. Quite frankly, doctor, this is you giving your patients feedback through the course of care, making sure they know they're making progress. Number 2 is loyal patients need forecasted care, which we've already introduced. This is part of the No Surprises Act, of that you forecast it out. The patient is being told right up front how much care they're going to be needing, how frequent it is, the costs, all of those things. They know in advance. Number 3 is loyal patients need frictionless payments. This is a big component of creating loyalty, is that there's no friction in the payment experience, that there's no bills being sent to them in the mail, there's no balances being accrued. Everything is automated. Everything is being collected at the time or in advance of service. Loyal patients need frequent contact. This is kind of our patient education component. This is where you're emailing them regularly, you're interacting with them on Facebook, you're interacting with through text message, you're interacting with your patients frequently, so they are frequently contacted with you. That's an important component. So these 4 components, we actually refer to these as the retention principles. And to make it easy, we call them the 4 Fs. That's just an easy way of remembering them: feedback, forecasting care, frictionless payments, and frequent contact. The 4 F's are what you do throughout seeing a patient, throughout the entire journey of seeing a patient, that ultimately leads them to becoming loyal. And I'm kind of saying that quickly here. When you do these 4 F's throughout seeing a patient, from phone call, through enrolling in care, through providing care, through transitioning to wellness care, when you do all of this stuff throughout the entire process, it leads them to becoming loyal to the practice. So to create patient loyalty, you apply the 4 F's throughout the loyal patient journey. This is what that journey looks like. And at the end today, I'm going to show you how you can get a copy of this for free. I'm going to give you, everybody, a copy of the loyal patient journey. No problem, I should say, for free. Our gift to you guys as a thank you for taking the time and making the decision to be here today. The loyal patient journey is literally like a game board. It's a step-by-step process you go through of seeing a patient and all the things you need to do. You might notice on this game board the dangers. See, I go back here and if you look, between step 1 and 2 and 3, you'll see those danger symbols. What are the dangers? We've identified throughout seeing a patient through the entire process, there are predictable points in time where it's common to lose a patient, where it's common. For example, have you ever had a patient who came in for an initial visit and didn't come back for the report of findings? Sure you have. Have you ever a person who got a report of findings and didn't come back to start care? Of course you have. Have you ever had a patient who started care and then dropped out when the pain went away or when the insurance ran out? Of course you have. Have you ever had a patient who was getting care and then kind of lost motivation somewhere later on and just kind of fell off? Of course you have. And have you ever had a patient who got to the end of a treatment plan and when it was time to transition to wellness, just fell off? Those are all dangers. They're very predictable, and we've identified what causes those and what you can do to prevent them. You'll see here again on the game board, we have throughout this entire loyal patient journey identified these very clear, specific areas where it's easy to lose patients. And we'll show you where on a web page you can go to later, where you can actually dig into what are those dangers, how to identify them, what do I have to do to prevent them from happening at all. So again, we'll give you a copy of this later on. So I want to start with the end in mind. So we kind of dug in deep here so far of kind of introducing this whole concept that we have this No Surprises Act. It's really telling you to do something that's going to help you in your practice, which is go over a care plan, go over fees with people in advance. Now, I should say, it's not telling you to do a care plan. If you're of the mindset, I just want to do 1 visit or 2 visits with a patient, you can do that. You still got to go over the fees in advance. So let me just clarify. There's no requirement you have to do a comprehensive care plan. I'm making the recommendation you do that because we see practices that do have greater success. That's simply the transition there. When we define success here, that's you to define it. That means how much money you're making or how much time you have free or how much vacation time you have or however you define success. And our method of getting that success is by focusing on retention. That's what we advocate, not saying it's the only way to have success. I could theoretically bring someone on to teach you how to do personal injury. That's not a retention business. That's just, getting lots of PI patients and how you work in that system. And you can probably have very good success in your life doing personal injury. And that's fine. In this model, we're seeing most of our patients are family, wellness, kids, that type of thing. And our goal here is retention with these people. And the way we do that is we execute what's called the loyal patient journey. And that's what we're seeing here, that the journey is what leads to retention. The retention is what leads to success. And that journey is based on 4 principles. I shared those with you already: feedback, forecasting care, frictionless payments, and frequent contact. Those 4 principles are done throughout the journey. And when we do enough journeys with enough patients, our practice will be full of these people that are loyal. That will give you a practice that has high retention. And as I shared earlier, practices that have high retention are generally very successful in practice. Let me show you some examples. I want to kind of illustrate what this looks like. You can see the fingerprint literally of what a practice that has loyal patients looks like. What I'm about to show you are some graphs, some charts basically showing the financial representation of cash collections. Now, this is not their insurance money. This is just strictly over-the-counter money that the patient is collected, the doctor's office is collected from the patient directly, out-of-pocket expense, out-of-pocket payments over the course of years. And what I want to emphasize, my hope is that you take away from these charts here is that this isn't a quick overnight, next week I'm collecting more money and next month I'm collecting. It's that as you're growing your practice and as you're adding more loyal patients to the practice, it continues to grow year after year. If you look on my screen, you'll see this goes all the way back to 2007, 2008 here. So we're in 2022 right now, right? So this is a long time ago, 2008. This office collected $142,000 in cash. Next year, they collected 206. Next year, 271. Next year, 313. Each year of collections, you see them continuing to grow. And they're really starting to gain some momentum. Here it is, 2015. That's 7, 8 years after they first started doing all this stuff. So this isn't overnight. This is as you're building your practice, as you're adding people. Now, obviously, the more new people coming into the practice that you're doing this with, the faster you would grow this. Here's an example, 2016, 2017, 2018, they had their first $1 million cash collection year. 2019, 1.3 million. 2020, the year of COVID, 1.7. And in 2021, they did 2.2 million. Now, you'll notice that this chart is growing year after year after year. And I will tell you that the doctors who apply these 4 principles I just shared with you of the frequent contact, frictionless payments, forecasting of care, okay, that's the one we're primarily going to be focusing on today. And the feedback. When you do these 4 things throughout the entire course of seeing a patient, you keep adding people to the practice. You keep adding people to the practice. And what you don't do is lose them. See, most offices we see, they have a revolving door practice. Lots of new patients. In fact, there's a constant need to market for new patients. Ask yourself, are you spending time every week constantly, marketing for new people? Do you have a whole department for marketing? The odds are, if you do, it's because you're not keeping them as long. You're not keeping them on the back end. We see on average about 24%. Like this practice here, when we look at the stats, they averaged about 24% growth year after year. Decade plus. We're going from 2008 to 2021 in this example. That's over a decade of growth every year. I don't know of any other practices that do that. I don't know PI practices that do it. I don't know cash practice. The only practices I see growing like that are the ones that are adding new patients and not losing them on the back end. And the care plans, this whole thing from the No Surprises Act of putting people on going over fees in advance and enrolling people in a care plan, if you're going to add that component to it, we see this level of growth in the practice. Here's another one. I'm going to go through a few examples of these. This office back in 2016 did 363,000. You can see on your screen yourself, it went from just 650, 909, 1.1 million, 1.3, 1.7. Again, example after example. Here's one from 2012 to 2021, another practice of growth. This practice is doing quite well. They were doing over $1 million since 2013. And in 2021, they did their first year over $2 million. Okay, here's another one. They had their first $1 million year in 2015, and they've been growing ever since then. The point is that practice after practice that does this in the long term grows. This is not an overnight get rich quick scheme type thing. That's none of this stuff, right? This is simply delivering on the promise of chiropractic care, giving people the results, helping them follow through. And as a result of them not leaving, your practice grows. Every one of these examples, every one of these practices is exactly that. And I'm hammering this point because so many times we talk to doctors and they just don't get it. Let's be frank, as clinicians, most of us aren't business savvy. That's just the nature of people who are attracted to healthcare aren't business people. So the intention here is to share with you that you can be very successful in your practice financially. And again, the finances, I don't want to dwell on this too much. It's just merely a representation of the value you're bringing to the marketplace, how much value you're bringing to your community. And again, this is not insurance money. This is strictly money paid out of pocket to people. Here, this practice did 4.3 million last year. It's incredible the results these offices are getting when they apply these principles. And this is what it looks like in a practice. I'm just showing you a quick picture. This was actually my own practice with photos on the wall of literally hundreds and hundreds of patients who've been with me for dozens, if not hundreds of visits over the course of many years. And that's what it ends up being. You have a large group of people who are seeing you for a long period of time and are loyal to the practice. That's really the ultimate aim here. And the No Surprises Act, quite frankly, helps you in that. So, yes, the No Surprises Act is pretty simple. Tell people fees up front, make sure they agree to them, make sure you have them sign a document saying they've done so. And that's really what it comes down to, quite frankly. And what we're saying here now is that it might stir some of you who have not been doing care plans to actually start doing them. Systems trump mission statements. What's happening in the halls trumps what's written in the walls. What it basically means is what you're doing is more important than your mission statement, quite frankly. You either have systems by intent or default. Your systems are always a result of what you've created or what you've tolerated. So the question is, when I say this, when I refer to this quote, like everybody has some system in the practice. Like, for example, you might have a system in your office where people stop at the desk every visit and they don't pay and they leave. And then you have to send them a bill in the mail every month to collect their outstanding balance. Like, that's a system. It's a terrible system, but it is one. And it's probably one you've tolerated, if you're doing that. So have you created systems or applied systems that are well designed in the practice? Great systems are a set of procedures based upon clearly defined set of principles that determine how you do something. So I mentioned the 4 principles, right? Feedback, forecasting care, frictionless payments, and frequent contact. Those are the principles. The question is, do you have systems in place to help you execute those principles throughout the loyal patient journey? Now, we're focusing right now primarily on the forecasting of care. I mentioned the frictionless payments there because they kind of go hand in hand, that if you're going to forecast care, build out a care plan, and have people paying for this, you want to make that payment automated. Even if you're not doing a care plan, even if you're doing one visit at a time, you still want to automate the payments for those people. So that you're not having them stop at the desk and make a payment. So you're not having to send them a bill in the mail. You're not doing things that remind them of money over and over. You want to make that as seamless as possible, because the more your patients think about money, the more likelihood is they're going to drop out of care, is quite frankly the reason we do it. So your patient visit average, that's the term kind of used to kind of broadly define how long someone stays with you. The patient visit average is significantly impacted by your forecasting and how frictionless you make your payments. In fact, when I interview a doctor, if they tell me and I kind of learn how you collect your fees and how you do the business side of things, your PVA is pretty predictable. It's almost uncanny how predictable your PVA is based upon how you do these two things, regardless of whether you educate your patients, whether you do new patient workshops, whatever, all this other stuff we've been taught to do to educate our patients. And we believe is what goes into making someone be loyal to the practices. If they knew what I knew, we often believe they will do what I do. And I think we could all agree, we've had patients who got the big idea of chiropractic and still dropped out. And you probably have patients right now who still don't understand chiropractic, yet they're still your patient. And they've been with you for years, as an example. You're probably agreeing with me right now, shaking your head, in agreement that you have those people. And what we've identified is that your PVA, your retention, is significantly impacted. In fact, more so than anything else, by these two F's, the forecasting of care and how frictionless you make payments. So I want to go through some examples for you, because there's lots of ways you can do this in practice. And I want to show you, depending on how you're doing this, what impact it's probably going to have on your patient retention. So number one is per visit. That means your forecasting is, I'm just telling the patient one visit at a time what they have going on. Meaning they don't even know they have how many visits they have. And you basically, every visit you say, well, yeah, I'll see you another visit, or no, I won't, that type of thing. There's no real plan. These practices usually have people pay per visit, and their PVA is around 12 generally. Now, again, in this pay per visit model, if you're doing that, again, you've had someone sign a document in advance for the No Surprises Act, letting them know what their fees are and what their responsibilities, et cetera. You've still done that, even if they're a one visit and done. And so my mind goes to is that if you're already going to be doing that, then you may as well be doing it where you're not just doing one visit at a time. You may as well reveal to them that they're getting, what you truly believe they have. I've had doctors share with me that they know they're going to need 3 or 4 months of care with a patient, or 5 months of care, but yet they don't tell them that up front. And, now they do, and they realize, and they say how much better it feels to be honest with people and just tell them up front what they know they're going to need. The next is the exam to exam. This is the doctor who's saying to a patient at a report of findings, for example, let's get you started with care. I'll reevaluate you in a month, and I'll let you know from there what we're doing. Like, there's no real prediction beyond the first maybe 3 or 4 weeks of care. And that's what the patient's told. Let's get you started. Let's see how you do. It's 10 visits or 12 visits, whatever the recommendation is. And at the re-exam, the doctor then has to convince the patient that they need more care, for example, or, recommend more care, example. And I say the word convince because many times doctors have that gut feeling that that's what they need to do, is almost convince the patient they need to continue care once the symptoms are gone, as an example. These practices generally have people purchase care in blocks of visits, like 10 or 12 visits at a time. Again, you're sharing that with the patient up front. Hey, this is 10 visits at X number of dollars. Here's the total cost of that. Here's what it is in advance. And they've signed a document actually agreeing to that for the No Surprises Act. So in essence, this practice is having people prepay for 10 or 12 visits, let's say. Generally, we see these offices with a PVA around 24 to 36, usually where it tops out at. No matter what else you do, they get stuck there. And the primary reason for that is because most patients end up dropping out after 2 or 3 re-exams. It's usually what ends up happening is about the 2nd or 3rd re-exam, the patients leave the practice. Number 3 is the care plan, which we've already been talking about. This is where you're packaging all your services. It's comprehensive. Let's just say that. You've told the patient up front 6 months of care, 4 months of care, or a year, whatever. Again, whatever you've determined the person needs, how many visits, how often you're seeing them, what's being done in those visits, all of the services, all the fees, what's the total. And in this case, what we're seeing in this type of care plan is there's an option to do a prepay. Now, the prepay is something that's been taught in our profession for many years. I'm not a fan of it myself, but it is an option that's out there where doctors basically close the deal or sell a care plan. I personally think it's not a good model to go after, but nonetheless, it is out there as an option for those patients who want to do so. Majority of patients do not want to prepay for things. That's not how they live their lives. But many chiropractors are kind of in this mindset, well, I'm going to sell care plans and close the deal. Not suggesting you do that, but nonetheless, these offices, they do have a higher PVA. They do. They're about 50 to 75 is a higher PVA. And for many of you, you'd be like thrilled to have that. Like that would be ideal for you in your practice to have a PVA that high of retention, but it's still not the best you can do. The next is a care plan, still a care plan. So it's kind of the same as the previous one. It's still everything that you're recommending for care, but it's a monthly auto debit where the payment is being automated on a monthly amount for the total cost of the plan. It's an installment basically towards the total price of the plan. So instead of the patient prepaying for it, instead of that, they're paying it monthly. Another option might be, which I really like, is they make a small down payment. So a little bit of a prepay, I guess you would say, maybe a third of it down, and the rest of it's paid monthly. These practices generally have the highest PVAs. And when I showed you earlier all those charts of the, the graphs of the growth of collections, generally the majority of that practice is on a monthly auto debit. Not all of it. It's a mixture. There is a mixture in there for sure. But the majority of those practices have a lot of monthly auto debits going on, or they've automated, even the patients who are one-time payments, it's all been automated. So when you look at this, the practices that have the highest PVAs are primarily doing care plans and primarily doing monthly auto debits. That's what we typically see in these practices. So going back to the beginning of the No Surprises Act, the No Surprises Act is basically saying, tell your fees in advance, get agreement with it. And that's what we do with all of these examples here, whether it's a care plan, exam to exam, or a per visit, they're agreeing to it in advance. I'm suggesting that to have the most success in practice, if you're presenting finances, is to actually do the care plan along with the auto debits. So let's take a brief look at what that looks like. I'm going to actually log into our application for a moment here, and I will show you how simple and easy this is to do. Now, this isn't meant to be a full-on demonstration of the software. I just want to show you how simple it is to utilize this in order to satisfy the No Surprises Act good faith estimate. So you're required to do a good faith estimate. That is a requirement for you to do. And again, just kind of making up your own thing is not really the way to go. It's not professional, as well as it can get you where you're not being compliant from the standpoint of all the things you need to do. Now, when it comes to a chiropractic office that, obviously we're chiropractic, there's some things in our care plans that we have in there that aren't necessarily part of a generic document you might get from, Health and Human Services or whatever the website is for getting, documents from the government. I know there's some samples out there of just kind of generic good faith estimates out there that you handwrite in your stuff. I don't suggest you do that. What I recommend you do is exactly what I'm about to show you. So simply, I'm going to go to what I call our care plan calculator. Care plan calculator. It calculates your care plans. And let me just bring one up that's been created already. I believe it's in here under ChiroHealthUSA for this demo for our webinar today. No, it's the patient name.
Yeah,
Just hit search. Okay, it's told to hit search. There it is. For this one here or this one?
Yep, that one there for Angela.
All right, so there we go. I'm being coached on which one to go to. So here we go. On this care plan calculator, basically what we do is we go in and we put in our patient's name and we list out our services and fees. So we very clearly put in here in this particular care plan, I'm recommending 40 visits. I have visits in here right here, adjustments not covered by insurance. So this is an example where I'm building a care plan where there is no insurance or the patient has opted out of their insurance, but nonetheless, they're paying out of pocket directly for the service. There's no insurance portion. And I'm saying all 40 visits. And in this example, we're charging $75 a fee. But because we're part of ChiroHealthUSA, and I just want to show this as an example, maybe I set up my ChiroHealthUSA agreement to have a $55 cap for those services. So I've capped it off at $55. Again, when it comes to the training side of it, we will coach you through how to do all this stuff. I just want to show you it's very simple to do once you've learned it. And in fact, once you become a client doing this type of thing, you build all kinds of templates of these in advance. So you're not building these from scratch each time you see a patient. But in essence, this is the exercise of building out the good faith estimate using the care plan calculator. So we're going to say here we have 4 progress exams. We have a set of progress x-rays, a healthcare class, a traction unit, some therapies, and you just list out all of your services and how many units and what's the actual fees of all of those things. You on the left here also going to apply what discounts are being applied. And that's a subject beyond today's time we have, but there's discounts that get applied to your services if you want to apply discounts. And of course, if you're using ChiroHealthUSA, obviously you're doing some type of discount with your services. you would select on the left here what type of discount is being applied. So for example, when we do a service, if we were doing anything that was insured, like you see up here, covered by insurance, you'll see the discount rule is full fee because we don't discount covered services as an example. So we're only discounting the services that qualify to be discounted. Once we do all that, we hit the calculate button and you'll see come up on your screen here as an actual calculation of the care plan. So it calculates it out and you see here the actual care plan calculated out. And on this care plan, we're going to go ahead and hit the view button. And on this view button, it'll actually produce the actual care plan for you. Now, when we bring this care plan up, you'll see right here under the name of it, it says good faith estimate right there. This is the actual document you'll actually print off to review with the patient. So what I'm showing you right here is something you would do in advance of a patient coming back for the report of findings, in advance of it. So we actually call that step 4 of the loyal patient journey. Step 4 of that journey is you or your CA preparing the care plan to present to the patient on step 5 at the actual report of findings. So page 1 of the document shows, again, everything calculated out, your total fees, if it's a discounted amount, what that discounted amount is, and it presents them 3 payment options. Option 1 being is it's paid in a monthly installment. Option 2 is they make a down payment, smaller payment, monthly payments. And then option 3 is a prepayment. And the patient would choose what worked best for them. So there's no, forcing that, oh, you got to prepay type thing. That's not the model. It's here's your 3 options. You tell us what works best for you. And everything is laid out for the patient on here. For example, it has on here some of the requirements like the date of birth, diagnostic codes, the tax ID number, the NPI, all of those things that are required by the No Surprises Act. It has the illegal terms of the agreement, like they're acknowledging is there discounted fees. What if there's insurance? What if there's, what if they have to stop early? What if there's a car accident, another PI case, etc. Yada, yada, yada. What if they go on vacation for a few weeks? Like all the things that might come up during the course of caring for someone, all of those terms are laid out in the description here. So there's no confusion for the patient and there's no confusion for your office on how you handle those scenarios. And then the final page is where they simply agree to all the terms, they sign it. And again, this is something you print off. As an example, I might hit the print up here and you'll see it prints off the document. Imagine printing this off and you're reviewing this with a patient at the report of findings. That's in essence what you're doing here. You're printing this off and then it's going to get reviewed with the patient prior to them enrolling in care. And that satisfies the No Surprises Act, or helps satisfy the No Surprises Act by giving them this good faith estimate in advance. That's the intention of this. Now, if I wanted to incorporate insurance, I'm going to keep this really brief. I don't want to bore you with too many details here. But if I wanted to include insurance, let's say out of the 40 visits, we determined the patient had 10 copays, and those copays were $33. That means we have the remaining 30 visits are the ones that are non-covered, meaning they're not covered by insurance. And I would just simply recalculate the plan. And once I do so, you will see here, it just calculates the plan again. It's asking me to do one extra step, which I will do very quickly for the sake of time. And when it does, it'll calculate this plan for you. And this plan is calculated showing now the incorporated insurance. So now when the patient enrolls in this, no longer will you have to worry about when the insurance runs out, sitting down with the patient and trying to convert them to cash later. If you've been doing that now where you use the insurance and then you say, well, when their insurance runs out, then I'll convert them to the cash program, I guarantee you your PVA is terrible. That practice is always going to lose people, or I shouldn't say always, there's no hard fast rule, but most of the time you end up losing people at the point where their insurance runs out. If you're being honest with yourself, you know that's true. So when you do this as a care plan, you never lose patients because the insurance ran out. Because once they commit to this, that monthly payment doesn't change at the time their insurance runs out. It's what they've paying right from the beginning. So it helps you get rid of that danger. We'll talk about the dangers on the loyal patient journey. The danger of losing someone because the insurance ran out goes away, is neutralized when you put someone on a care plan. So if you're struggling with that, here's a reason in of itself to do a care plan so that you're not losing it because the insurance ran out. I'm just going to quickly show you this last thing and then we'll move and then we'll wrap up here. And that is when we enroll the person in care, we're actually signing them up for care. So this is now, you printed off the good faith estimate. You sat down with the patient and you reviewed it with them. They've agreed to sign up for care. And now your CA is going to enroll them in care. They're actually enrolling into the care plan. When we do that, we would choose the payment option. Let's say it's option 2. And we're going to go down here and choose the card on file that we have for this person. So we'll choose the credit card we have on file. We're going to also use the card on file for their recurring auto debit. So what this is showing is what are you using to charge that initial payment of $779 right now? Because we're choosing, again, option 2 is $779.40 down, and it's going to be 5 monthly payments at $226. What we're accomplishing in this step right here is in one simple step, we're charging their initial payment. We're scheduling all their recurring payments being frictionless. We're creating their agreement, their good faith estimate for them to digitally sign. So you have an electronic sign, so it's paperless. And you're also going to assign an email campaign to start educating them. That's that F called frequent contact. We're doing all these things in one simple step here. I scroll down. Now, if I cruise here, I can say, okay, assign an email campaign, which I'm not going to actually do here because this is just a demo, but I could do that. And I'm going to hit enroll patient. And when I do, it'll go through the process of enrolling them in care. And you'll see what comes up on the screen here is the receipt for their initial payment for them to digitally sign. It'll show the actual agreement. So you see there, it says electronic signature. Here's the receipt. Here is their schedule of payments. And here is all of the good faith estimate, all clearly defined and taken care of. All you need to do now is get the signature on it and you're done. CAs absolutely love this. This becomes their favorite tool in practice because of the fact it's simplifying their lives. Not only is it helping you in practice, doctor, but your CAs absolutely love it. Holly, do we have a digital signature pad here? It's not plugged in. So normally I would sign this electronically. It would go ahead and sign, and it would capture their signature, and you would see just kind of like you're used to using, DocuSign or something like that. It just applies the signature to the entire plan, and now you've completed the process. You've accomplished you've satisfied the good faith estimate requirement of the No Surprises Act by enrolling your patient in this care plan and capturing their signature on the actual document. Once we're done with that, we've completed the process of enrolling the patient. If I now go back to the slides here and show you on the next slide here, this was what I just showed you just now was step 4, which was the actual building of the care plan. And again, when you are trained on how to use this, you don't actually have to build these from scratch. Initially, you'll set up a bunch of templates that are common for you to use in your practice. I think most of us have probably about 6 to 12 different common treatment plan templates that we would often use. You just have to customize them for each patient, custom tailor. Maybe you have to add some insurance in, or maybe you want to change a few things, but you don't have to start from scratch each time. That's step 4 here. Step 5 was actually presenting the care plan to the patient. So you actually sat down with your patient and reported findings. You reviewed the findings with them. They agreed to care. You went over the finances, or your CA went over the finances. That's what this is all showing here in step 5. And step 6 was that last little part where I actually enrolled them in care. I went through the process of signing them up for care. And you'll see on this document, there's lots of descriptions in here for you to read through to learn more about those. I promise you can get a free copy of this. Let me bring that up on the screen for you here. You can use your phone and just scan the QR code there, and that'll take you to the page. Or if you'd rather, you're sitting at your computer right now, or you just want to come back to it later, go to loyalpatients.com. Loyalpatients.com, when you go there, will let you download a digital copy of the Loyal Patient Journey in full size so that you can see and read it, and it's very clear for you. It's a nice PDF ebook for you. As well as if you would like to learn more about how you can use those systems, if you scroll down on the page, not only, let me also back up. When you're on the page, Loyal Patient Journey, or loyalpatients.com, when you're on that page, after you download the ebook, if you scroll through the page, you'll actually get to interact with the Loyal Patient Journey. And I encourage you to take, 15, 20 minutes when you're sitting on your sofa at home on your phone or on a tablet, just scroll through it and you can click on each step. It'll educate you about that step. There's some videos you could watch teaching you about each step of the Loyal Patient Journey. Click on the dangers. Those dangers will share with you what the danger is, how you address it, how you handle that throughout it. All of this, by the way, is no cost to you. Just play around with it, enjoy it. At the bottom of that page, there's an opportunity for you, if you'd like to, book a 10-minute call to learn more about how we can help you, how you could learn how these systems will actually be applied to practice. No obligation. You can click on that and just book a 10-minute call with one of our team members, and they will do a Loyal Patient call with you and figure out with you where specifically in your practice you could apply these tools to help you grow your practice and also satisfy the No Surprises Act. When we saw the No Surprises Act come out and we saw that, we were like, oh my gosh, there's a thing here that is telling the world, it's obviously protecting patients and, as a consumer, basically, against bad practices, let's just say. And in essence saying you need to reveal your fees in advance. And again, we've been teaching this for 20 years now to do this. It's really important that you do this, not just from the standpoint of the No Surprises Act, which great, it's being done. Everybody will have to do this, but from the standpoint of you just growing your practice. I want to pause here for a moment and go back to Christy. If there's any questions that came in, I know sometimes there are, sometimes there aren't. I know I talk fast. I wanted to get through all of this material for you guys in a timely manner. I will pause here, Christy, and give you an opportunity to kind of jump in here if there's any questions. I guess do I need to stop sharing my screen in order to do that?
No, you can leave it up.
Okay, great.
And I also posted the loyalpatients.com in the chat, so y'all can click on that if you need to, so you can see or go to that page. Okay, so do we need to have patients sign a care plan even if declining one of the payment options to show that it was reviewed with them?
That's a great question. So my suggestion is if they're getting care, so that's a great question. So they're not enrolling a care. So my next question would be, are they just leaving the practice and not signing up? Or are they doing something else? If they were doing something else, I would have them sign that, whatever it is they're agreeing to. If they're leaving and saying, well, I'm not going to go anything, it's a valid question. I don't know the answer. We might have to reach out and say, should we have them sign something that acknowledges that we went over fees with them? That's a great question. I don't have the definitive answer at the moment, but it's worth us investigating. Holly, I'll just mention the question that was asked was, let's say you go over a care plan with someone and they don't enroll. Should we still have them sign it to show evidence we went over with them? And we probably want to reach out into our support team to get a firm answer on that. But
she said that they're not signing up for a care plan. They're just paying per visit. And I will say, because we were just talking about this before the webinar started, that I had my first doctor's visit where somebody had to go and do the No Surprises Act conversation with me. And at the time of the visit, we discussed what was being done that day and potential things that we would have to do in the future. And they had me, I wasn't agreeing to care, but I was agreeing that they had gone over the fees with me.
Yeah.
That's what I signed.
Yeah, that might be something we will, if we turn out that that's a common scenario, we'll probably create something that is an acknowledgement of reviewing this. Like almost like it might even be, as I think about it, I'm just kind of thinking out loud, another page of the care plan that when you print it off, it's kind of like a page that you would throw out if they signed up. But if they don't sign up, you have them sign that instead, saying they acknowledge that you reviewed this care plan and they're electing not to do it, per se. We'll find out details. I don't want to create something unless it's actually an absolute necessary thing, but it's a valid question.
We have an attorney who piped in and said the answer is the NSA doesn't require patient signature, but it is a best business practice to get it and store it so you have proof that you did get it.
Excellent.
We currently give all maintenance care patients a billing acknowledgement to sign before care. With a good faith estimate, will it end up making that step unnecessary?
Say a billing acknowledgement. Say it again.
A billing acknowledgement to sign before care. For all maintenance care, I guess they're acknowledging that they're self-paying.
Yeah, I'm not familiar with that term. I'm going to guess it's basically a document that says what the fees are. But really, the takeaway message is you need to inform people in advance. And there's not a specific. I think this early in the stage, as long as you're doing something in advance. And again, we'll probably get more clarification on this as time goes on, but I don't know the answer whether or not it would eliminate it or not, per se. If it's redundant, then I would say yes.
I would agree. Does NSA have any effect on uncollected balances for services provided in prior years?
I don't believe it's retroactive. I don't believe it is.
Okay.
That would be a difficult thing to do as far as I'm concerned, but I didn't see anything that says it's retroactive.
I don't know what. It would seem to me that it would be really hard to enforce something that says that as of January 1st, we have to do this, but you can't collect on unpaid balances because. And
speaking of enforcement, as far as I've read, this is going to be patient enforced. There's no third party agency that's going to be knocking on your door, at least initially, that's kind of auditing you on this. This is going to be one of those things that a patient needs to actually be told how they could. You know how there's the consumer things where you go somewhere that says, here's how you may file a complaint against XYZ company, blah, blah, blah. That kind of language does need to be put out. Like if a patient wants to file a complaint or whatever, maybe how they go about doing that.
Right. Okay. So this is a question. How do you get patients to sign up with care plans during the inflation we are going through? I feel like if I list the fees and give them the total, that would scare them off and they may find other places that would provide one-time treatment or the joint for $29 initial and 4 adjustments for $80. What are some ways you suggest to get patients to sign up? This is a great question that we have gotten many times over the years.
Yeah.
So, Miles, what do you
So we could do a 3-hour seminar, 4-hour seminar on that topic alone. Let me just share with you that I hear your pain. I hear your frustration in that question. It's a valid, honest question to ask that. The answer I'll give you, which I know is not going to satisfy you, it's not hard to do if you learn the proper communication skills. Let me just share with this. What patients don't want is to feel sold. That's the bottom line, is they don't want to feel sold. And the unfortunate thing is that most doctors, when they learn how to do care plan presentations, what they learn is how to sell. And when they learn how to do it, it makes the person that they're doing it with feel sold. In fact, you've probably had patients come to you who might even said to you, hey, that last doctor I went to wanted to sell me something. I don't want that. And you're like, oh, I'm not going to do that. I'm just going to pay one visit at a time. The reality is that patients want your best recommendations. They just don't want to emotionally feel you selling them. So there's a way to do that. There's a real skill and art to selling without sounding like or feeling like you're selling. And we do teach that. And the doctors that you all see having that success with those charts I show you, they're all doing that type of communication with patients where it's just natural for them to want to use your services. I know that doesn't answer your question directly. I'll just say this also. When you're doing a care plan recommendation, you don't discuss money with patients until you've gotten agreements to the treatment plan. And once they've agreed to the treatment plan and they understand the value of it, understand the need for it, and you've gone through the process of how to do it. And when I say understand, I don't mean you've educated the crap out of them about chiropractic. I just mean you've gone through a process where it's natural for them to like, yeah, doc, I want that. I want what you're offering. It's not until then where the financial conversation actually occurs. It's very easy to, quite frankly, to go over finances with patients once they've agreed to the treatment plan. I'll use an analogy. Whoever's asking the question, if there was a specific car, you went onto a car lot and a car salesman approached you, and I don't want to compare us to car salesman. That's not the intention here. But the intention is they want to sell you that red Corvette. And the bottom line is, if you don't love the red Corvette, there's no financial conversation they're going to offer you that's going to make you want to buy that car because you don't want the car. But if they get you to fall in love with the car and you absolutely love it, no matter how they got you to fall in love with it, but the bottom line is you fell in love with it, they're going to find a financial option that works for you. They're going to figure out a way financially to make it work, whether that means financing it a longer term, whatever it may be. But going over the finances up front would be a mistake. It's a mistake. You got to have people fall in love with the car first. So the analogy being is patients have to fall in love with your recommendations. And once they do, and there's a way to do it, quite frankly, the way that's done is beyond the scope of the time we have right now. But when they fall in love with it, they will follow you through. The financial portion. It becomes, quite frankly, very easy to go over finances with patients once they've done it, and they actually appreciate the transparency. Now, I understand what you're saying about the inflation. Everything's going up. That's just the nature of the world right now, unfortunately, and you have to adapt to that. Obviously, if you ever need to raise fees, now is the time to be doing it because everything's going up.
I would totally agree with that. If you have not evaluated your fees in the last 5 years, I'm giving y'all my ugly stare.
Yep.
What are you doing? Because everything's been going up for years, and there's an ebb and a flow to the economy. And I will add this because we do a communications class too when we're on the road, and people do business with people they like, and people will spend money on things that they want before they spend money on things that they need. Mm-hmm. And there are, I can't even remember I just did an article about this, about the number of millions of people in this country who live with pain every single day. Pain isn't what brought them into your office. It might be what they said brought you into their office, but something in their life got disrupted that they care about and love. And that's why they came into your office. So you've got to figure out, what is that bottom line? Is it because now they can't go walking with the ladies in the neighborhood every single day? They can't play with their grandkids. They can't go to their dance class. It doesn't matter what it is. They can't play golf, whatever that reason is. And then when you're talking to them about the care that you're recommending, it is not about eliminating pain. It's about getting them back on the golf course. It's about getting them back to the dance class and reminding them why they came to you to begin with. And it wasn't the pain. It was because something in their life is missing and they want that back.
Absolutely. Absolutely. So, it's a valid question. It's a good question. And it's a common question, quite frankly. And if you've been in the one visit at a time model or the insurance model, quite frankly, the communication is the polar opposite of what you're used to doing. which means you could struggle trying to figure it on your own, but it'll be a struggle versus just simply learning from people who've already done it and figured it out. When people do work with us, if you decide to do a call with us, and by the way, we're not an expensive program. Don't be fearful. Like, people can join our program and use cash practice for as little as $49 a month. So we're not talking, a big, giant, expensive thing here. When you use our program, we have resources and tools, video trainings, things that are all included in that teach you how to do this stuff. So if you are self-taught, or are self-motivated, you could watch our videos and go through the process, like learning how do you sit down with a patient and actually get them to say yes to a care plan. I highly recommend. I recommend that you learn that because it serves you and your patients, quite frankly. So it's a long-winded answer to your question, and it may not have answered it specifically the way you wanted it per se, but I hope it steers you in the right direction at least.
So one of my dear friends, Dr. Lolis in Texas, said that she recognized your 4Fs from an article she read in Chiropractic Economics.
Great.
I posted that link so people could go back and read that because I can't find that issue in this pile of magazines.
And I'm most excited to hear she recognized it. And the reason I'm excited, it's like, I'll tell you, the nomenclature of the 4Fs is something we started using about a year and a half ago. We're saying, how do we communicate what we teach? We as a company, how do we communicate it more clearly? And our first experience of actually using it was some time ago where we were teaching a class to CAs. Holly and I were in, where were we, Holly? Detroit. We were in Detroit teaching a group of CAs, and we taught it for the first time to a live audience that morning. And we came back from lunch, and when we were came back from lunch, here was the CA sitting in class, sitting with their doctors, teaching them the 4Fs. And it really struck us that people get it easily. So thank you for telling us you recognize it from reading it, because ultimately it doesn't do anybody any good to learn this stuff unless it sticks and you're actually able to apply it. So thank you for sharing that. I appreciate that.
Wonderful. She wants to know if this is someone implementing this for us. Is easy for someone who is a solo provider and they have an office mobile hybrid?
So 100% it's easy by your solo. In fact, I can't imagine practicing as a solo practitioner without it, because in essence, instead of you having to have this interaction about money on every time you see someone, not only, maybe it's not a pain, maybe you're using Venmo or something simple like that, but still it's a conversation you have to have with the patient. We're going to eliminate that step. In essence, everything becomes automated. So whether you're mobile or whether you're in person, in your office, everything is handled up front. Hey, here's how we're handling finances. And that means you're free to take care of this patient in the future, whether it's one visit at a time, 10 at a time, 50, whatever it is you're doing. And you don't have to have the conversation about money every single time. One of the big principles we teach is the more frequent a patient thinks about money, the less frequent they're going to see you. It's an inverse. The more money comes up, the less they're going to see you. So you want to figure out every way you can to eliminate the thought of money. Anything you do that reminds people of money, especially if it's repeated, sabotages your retention. So as a principle, we call that frictionless payments. That's what we refer to it as. You make it as frictionless as possible. Whether it's one-time payments or whatever it is. So the answer is yes. In a solo practice, whether you're mobile or not, regardless of that, solo practice, we have many, many solo practice or staffless practices or micro practices, whatever term you want to use, where there's no staff involved, where all of this is set up by the doctor and it streamlines things, quite frankly. So absolutely 100%.
Okay. Do you go over the care plan before the consult, or consult and exam, then the report? What if the patient says they have insurance and then you find out they don't?
All right. So the first answer is that when we go over finances, it's done at step 5, which is after they've had an exam and x-rays, the following visit at the report of findings. That's when we go over the care plan. Now, you may have done something for the No Surprises Act on visit 1 to handle, the exam and x-rays, but you're talking about the care plan. That's reviewed with them after you go through the treatment plan and they've agreed to the treatment plan. That's when you go over finances. So that's prior to them, you doing your first adjustment. You've gone through this with them prior to that first adjustment or first, decompression session, whatever it is you're doing in the practice. And then the next part of the question was, what was that? There was a second part of it.
What happens when a patient says they have insurance?
Oh, it has insurance and then they don't. Okay. So if they said they have insurance and you've built that into the care plan, now assuming, depends on what we're talking about here. If they told you yes, and then you go to verify it and you find out they don't, and that's part of the financial report of findings, you communicate that at the report of findings. Hey, we've called your insurance. What we found out is you don't have coverage, or that the coverage was exhausted, whatever it is, and you have that conversation. If it's you were told they have insurance and you built that into the care plan, and then they enroll in care with that assumption the insurance is there, but then later the insurance company says, nope, they don't have care. Well, then you have to go back to the patient and say, hey, the insurance company does not cover your services. And just to be clear, when you go over finances with a patient at the time, when you're actually going over the care plan, the scripting or the language that's used is, we verified your insurance. It's not a guarantee of benefits. If it turns out to be different, we will let you know immediately and we'll adjust your plan accordingly. Like that's communicated with the patient up front so they know, but you can only go off the best information you have, quite frankly, right? And we all know sometimes insurance companies don't give us accurate, that unfortunately happens. So with that being said, that's generally how we go about doing that.
I love it. Okay, we have a couple more questions, but we are running out of time because we've gone 10 minutes over. So rest assured that your questions will get answered. I'm going to email those over to Dr. Bodzin and his team, and we will get an answer for you. He's on vacay right now, and he won't be back in his office for a couple of days, but just know as soon as he sends me those, I will email everybody who attended today so you can see what the question was and how he answered. Just know that it's not going to be today. He's like 10 minutes late for leaving for the Smoky Mountains.
That's what I was told. I'm getting the stink eye about us leaving. I'm just kidding. I'm not.
Y'all are probably wondering, am I getting text messages too? I wasn't about that. So also for those of you who are wanting handouts, if you click on files, you'll be able to download those because Holly sent those over to me while Dr. Bodzin was speaking. Just wanted to remind you that next week we have the Marketing Master Class with Dr. Mark Santa. The last weekend of this month, we had something come up, so we're not going to be able to have a webinar, so you get a week off. I strongly encourage you to block that time out and enjoy 1 hour of peace and quiet. Just play something in the background. Your staff will never know that you're not on a webinar. Replay one and take a breather. Then we're going to open up April. We're going to be talking about what to do and how to protect yourself and your team from being sexually harassed by your patients. We have all kinds of webinars up all the way through June. And I've gotten, you see this email number is just going up. 2 of those are 2 more webinars to add to that list. So make sure you go to ChiroHealthUSA.com/webinars. Make sure you're registering for all of the upcoming webinars. We have some really exciting speakers, a lot of first-time speakers, and then of course some fan favorites too coming back. So any suggestions for what you want to hear, make sure you email me at Christy@ChiroHealthUSA.com, because when the emails come from you, I don't mind when that number goes up. It's just the rest of those people. Anyway, thank y'all so much for joining us today. I hope you have a fantastic Tuesday and an amazing week. And I will see you here, same time, same place next Tuesday. Bye, y'all.
Bye-bye.